Dr. Dane here, and we are now doing the Connect part of the day 1, day 2. You know, we talk about, the Discover part. We talk about Connect, Discover, Respond. You connect in your consultation, you discover in your examination procedures, and then you respond in your recommendations and your report findings. So I have my patient with me. This is Patrick, one of our trainers. And so the first thing I wanted to go over is a little bit of a background on the discovery process. Again, I think it's a lot better to show you guys than to tell you in a webinar format how we do our evaluation. So at this point, I'm usually finished my consultation. The consultation generally takes 20 to 25 minutes as long as I don't have a talker. At this point, I'm going to then educate the patient on what we're looking for in the evaluation. So I may say something like, Patrick, I really appreciate you giving me the information. It really helps me to have a better understanding of why you're feeling the way you're feeling and your health goals. I'm going to do my exam now, but before I do my exam, I'd really like to just show you what it is that I'm looking for to know if I'm the right chiropractor and I can help you, okay? So if you don't mind, come on over here. You may know as a chiropractor, and Raj will take a look over here. I'll try to get out of your way. Patrick, you may know as a chiropractor that I work with the spine, but you may not know why I work with the spine. If you look at the spine from the front, the spine should be straight as an arrow. If you look at the spine from the side, we have 3 very important curves in our spine. Right. So one of the things that we do as a chiropractor is we look for something called subluxation. And I know that's a big word, but you've heard of the word dislocation? Yep. Where the bone comes completely out of the joint. Sub, like submarine means less than. So it's a misalignment, but when you're talking about the spine, you'll see that every segment that I push on, there's 24 of them, you have nerves that come out through the spine. So you have a spinal cord that runs through the spinal column. Okay. You have spinal nerves that come off of that, and those nerves go to different parts of your body. Okay. So I'm going to be looking at areas in your spine, not just why you're having neck pain, but also if those nerves go down into your arm, it may explain why you're getting the numbness as well. Right. That make sense? Yep. Okay. So because the spine's movable, there's 53 joints in your spine, it's capable of moving out of its normal position. And when it does and it stays there, we see changes on x-rays. We see degeneration or arthritis. So we'll be taking x-rays today to see how long your subluxation's been there. If you have subluxation, Patrick, I'm your man. I can help you. If you don't, I'll find a doctor that can help you. Fair enough? Yep. Okay? So let's start with your exam. The first thing I do, guys, is we do blood pressure and we do resting pulse. So we'll take his blood pressure, we'll take his resting pulse. If you have a CA that's trained in that, I'd highly recommend they do that when they do their part of the exam. We'll talk about that in just a minute. The first thing I'm going to do is ask Patrick to come over on my bilateral scales. I'll take that. I'll say, so Patrick, step on the blue feet if you don't mind. Drop your hands down to the side, look straight ahead for me. So the first thing I'm going to do is just take an overview of Patrick's posture. Patrick looks pretty good here. He's got a little deviation in his shoulders, a little bit of a head tilt in translation to the left, but really not too bad. But let's see how he's distributing weight. And he's almost perfect. He's 96 on his left side and 95 on his right. So you can see 96 and 95. So Patrick, you did really good. Next thing I'm going to do, guys, is I'm going to do our functional movement screen. So I'm going to grab the piece of PVC. Now, recognize that Patrick is one of our trainers, and Patrick moves really well. So we're going to show you what a proper movement screen would look like, but recognize that most people are failing these tests, and I'll go over that as we do them. So Patrick, I want you to take that piece of PVC. First thing we're going to do is something called an overhead squat. And what I'll do, guys, I'll generally grab the PVC and I'll show them. Let's say, so what I want you to do, Patrick, I want your feet shoulder width apart. I want you to lock that bar up over your head, and I want you to give me your best squat as possible. I want you to go as low as you can, and I want you to come back up. And the key here is I want you to keep the bar over top of your hips. I don't want you squatting like this, okay? That's not squatting, that's praying, right? So I want you to just drop straight down, low as you can, and then straight back up again. Perfect. Okay? And Patrick, what are some common faults that you see with people do overhead squat? I see the knees buckle. Yep. People can't maintain their shoulders over their hips because their lower back is really rigid. Ankle mobility, generally the heels come up because the ankle mobility is limited.
Yeah, definitely. I mean, the biggest thing that I see is the coming forward with the bar, just because they don't have the thoracic mobility to get all the way down.
Right.
That's the biggest fault we see.
Okay. So next thing that we're going to do, Patrick, and this, guys, you can use the bar with. We're going to just test your core stability. I'm going to have you lift one leg at a time, hold it at 90 degrees. And the key, guys, and see, a lot of doctors do this, they don't have people lift their knees to 90 degrees. Right. So it's not just lift the foot off the ground and hold it. It's bring your hip up to 90 degrees of flexion and hold that and show me that you can be stable on each leg. Perfect. And what you'll see is you'll see people correct, or they just can't do it,
Right.
which generally is a core stability problem, right?
Yep.
Or sometimes it could be a neurologic proprioceptive problem too. You know, if their wiring isn't good for their core.
Yep.
Okay. Next thing I want you to do, Patrick, this is to test your upper thoracic mobility. And again, you'll see people that are kyphotic are going to have a real hard time with the shoulder pass through. So we want to test your shoulder mobility and your upper spine mobility. So what you do is grab a wide grip on this bar, stand up real straight, look straight ahead. Don't bend your elbows, but pass that bar all the way to your lower back. Grab it real tight, pass it all the way to your lower back, and then pass it forward again.
Got it.
Perfect. Awesome. And so what are some common faults that you'll see with that, Patrick?
You'll see a lot of the bending of the elbows, which you don't want. That's mainly the big one. What we do with people is give them a band to try and work past those sticking points, because they can pull the band apart a little bit and try and work on that thoracic mobility rather than the rigid bar.
Right. And with the rigid bar, they won't be able to bend that band, and that's why it's a pass or fail test. You'll see the elbow bend. They simply can't do it because they don't have the external rotation of their shoulders or the thoracic mobility to do that. And then the last one for standing is the lunge test. Okay. So lunge test is real simple. I just basically have them put their hands on their hips. I ask them to lunge all the way out, lightly touch the back knee, come back up again, and then step out. We're looking for midline stability. In other words, I don't want you swaying side to side. I want to see that you can control that movement all the way through the lunge. Great. Now, what I see a lot of time with the lunge is they collapse and they have to like push up, which means they don't have the power in their hip flexors to get back up, or they simply can't, they don't have enough hip extension to be able to actually lunge properly.
Yeah, a lot of times we have some people hold on to the bar to even provide them more stability, and they'll still be kind of sticking their butt out because they don't have the strength in their quads, so that would be a fail.
Or the mobility sometimes in their hamstring to get down as well.
Yeah.
Okay, so now, and what I do, guys, I show them, just makes it easier. I'll say, Patrick, we're going to test your core strength now. And I'm going to test your upper core strength and your lower core strength. The upper core strength, what I'd like you to do is just lie on the table, cross your arms, and just show me that you can sit up on the table.
Right.
So just lay down, sit up. You don't have to yank yourself up, just roll up. The next thing I want you to do is you're going to cross your arms, you're going to lift your legs to about 6 inches, and I'm going to count to 10. You're going to hold that for 10. Okay?
Got it.
So I'll talk as Patrick is doing this, but we'll test. So many people, guys, can't just sit up. I know Patrick makes it look easy. Maybe I made it look easy, but so many people can't do this because they don't have core strength in their upper core. So now lift your legs here to 6 inches. I usually put my hands here, and I'll count to 10. And then after 10, I always say, Patrick, did that cause any pain in your lower back?
No.
Okay? A lot of people, they'll get facet jamming, and that'll produce pain in their lumbar spine. That's an automatic fail. By the way, pain on any of these functional movements is an automatic fail. Okay? Lay on your back, Patrick. So now we're going to test his hamstrings, right? So Patrick, what I'm going to do is just lift you up here, and you can see Patrick can get to 90. Most people are here or here. So if they can't get to at least 70 degrees of hip flexion, full knee extension, I fail them, okay? So we'll test both sides. Okay, what I generally do here, guys, is I'll test for, bend that knee, I'll test for hip mobility. So I like to see that their knee can drop parallel to their body, even if I have to push down. And you can see Patrick has pretty good hip mobility. Most people don't. They're going to be here, or you're forcing their knee down, or they have pain on that. And that's just a test for external rotation to see how their hip mobility is. And Patrick has really good mobility in both hips. Last test, Patrick, I'm going to have you lay face down. Now, the great thing about doing it this way when you're trying to be speedy is they're already face down. We're going to do hip extension, right? So Patrick, without bending the left leg, I want you to lift the leg up off the table as high as you can. And what we do is, it's kind of neat because I look at the chair rail. That's about 30 degrees of extension. I look for 30 degrees of extension. Patrick has it. And lift the right leg. Okay, and any pain on either one of those movements?
Nope.
Okay. Now, Patrick, what we're going to do now is I'm going to what's called palpate, or just feel your spine. I'm feeling for two things, Patrick. I'm feeling for alignment, so I'm feeling for those misalignments, those subluxated areas. And I'm also feeling for motion. Often when you have a subluxation, you'll see a restricted range of motion or movement in the spine, but you'll also feel tenderness. So if I hit a particular area between your atlas, which is C1, and your sacrum, which is down here, I want you to tell me about it, okay?
Okay.
So what I'll do is I'll start up at the axis, guys. I come right under the occiput, and I'll start palpating, right? And I'll say, so Patrick, any tenderness left or right there?
Yeah.
Okay, left, right, or both?
On the left.
On the left. I feel that right there, right?
Yeah.
Okay.
Yep.
And do you get headaches at all?
No.
Sinus problems?
No.
Okay. No problems with the eyes or anything like that?
No.
Okay. So then we'll come down, and I feel Patrick's a little tight there. Do you feel that one there, Patrick?
Yep.
More so on the left than the right, right?
Left. Yeah.
Yeah. So guys, it's just a matter of being a doctor now. You know, I feel hypertonicity on that left side in Patrick's cervical spine, upper cervical spine. He probably just needs an adjustment. Are you left-handed, Patrick?
No.
Okay. So then we're just going to keep coming down. Lower cervicals, so that's C7 there. Any tenderness there, Patrick?
No.
Okay. So that feels subluxated, but it's not tender. So I would just make a note of that. I'm filling this out on my form, guys, the whole time. C1 on the left, C3 on the left, C7 on the left. And I'm just going to keep coming down. And I give good pressure, right? So any tenderness there?
Yeah.
Okay. So that's about T7. And so any problems with digestion, anything like that?
No.
Okay. Now, guys, for me, I love this because I have my nerve effect chart right here. So I can go to T7 and say, okay, I remembered it's reflux and GERD, anything like that. But it's nice, we position that so as I'm going down, I hit T10, I'm like, oh shit, what does T10 go to? Oh, Patrick, you have any problem with your ovaries? No, I'm just kidding. Okay? But T10 goes to the ovaries and the uterus, but obviously Patrick doesn't have one of those. So we'll just keep going down. That all feels pretty good, right, Patrick?
Yeah.
Okay. Now we get into his lumbar spine. That's all moving pretty good in there. Right? Maybe a little restriction there. Any tenderness there?
A little bit.
A little bit. More so than these guys, right?
Yeah.
Okay. And then, guys, I'm going to come down to his sacrum. I'm going to push left, right. Feels more restricted on the right. Patrick, do you feel that? Or did you notice that or feel any pain?
No pain.
Okay. So I noticed it, guys, restriction. So now I'm going to come down and check his leg length. And lo and behold, look at that. He has a right PI on his left side with extra pronation on that side. Right? So if you come down here, Patrick or Roger, you'll see that if you look at his leg length, he's short, just comes straight down. He's short on his right side, and he's also pronating a little bit more, and that's because his sacrum, he has a PI ilium on his right side. Okay? So sit up for me. Now at this time, guys, I'm going to call in. I'm generally going to either take x-rays, I'm going to call my CA in. At this point, I'm going to take Patrick in, shoot my films. We do 6 films. We do 4 cervicals. We do AP, a lateral, a flexion extension cervical, and then we do 2 lumbars, AP and lateral lumbar. We do those on 14 by 17. We do our cervical on a 14 by 17 too, so we get most of the thoracic spine as well. So I'll go shoot his films. I'll bring him in. Now, generally, if my CA has had the time, she's already filled out all this information. So I just want to go over it. It's on the exam form here, but it's age, gender, waist measurement. So the CA has taken a waist measurement of the widest part of the waist, hip measurement, right? Their MSQ, their medical symptom questionnaire, height, weight, all this is filled out. Bilateral scales, I'll generally write in, so 1 pound to the left, right? And then they've done their BIA. So the BIA has already been done by the CA at this point, and they're writing in all these numbers: reactance, resistance, phase angle, body fat percentage, intracellular water. BMI is also on the BMI number is on the BIA chart as well. Blood pressure and pulse I've usually filled in here, and then the X-ray number we have to wait until we get the X-rays developed. And then anterior head syndrome is going to come off the posture screen mobile picture, which has already been taken by the CA. So basically the CA has her responsibilities here. I have all doctors do it differently. On the consult form, I have some one doctor offices that have CAs that actually do a lot of their consult. And then the doctor comes in and does the important questions, like the medications question number 2, like the life effect question, how is this problem affecting your life? So you don't have, even the CA, if they're properly trained, you can have the CA do a large portion of your consult. Like, a doctor doesn't have to ask a patient, how long have you been experiencing your lower back pain? If you have a CA, they could be asking a lot of these questions. What's the pain on a scale of 1 to 10? Does it travel? Those types of questions. Even some of the questions like trauma questions, if they're trained properly by you, you can save yourself time if you're a one doctor office. Okay? Now let me just take a look here. Anything? So, Roger, you'll see here, this is where I'm circling where the subluxations are, right? So I'm circling, okay, C1 on the left, C3, C7, L5, right PI, right? I'm pass, fail on all my functional movement screens. These 1 in gray are the strength tests, right here and here, and the white ones are the core mobility tests. So I'm going to write how many they passed. And again, restricted movement pattern, fail. Pain is an automatic fail on any of the functional movements. Roger, anything that I'm missing?
I think you hit it all.
Okay, so last thing I want to cover, guys, once the exam is done, I'm going to excuse myself, and I want to just go over. I've taken the films. The CA's completed their portion of the exam, and now I've come in. I'm going to talk to you, right? Say, Patrick. First of all, I want to thank you for coming in. It's really nice to meet you. I have to tell you, I really believe you're in the right place so far, based on what I see. But what I have to do is I have to develop your films. And your films are going to show me if there's anything on your x-rays that would prevent me from wanting to give you an adjustment.
Right.
I have found tumors and things like that on people's spine, so I need to take a look. I can't see through your spine. I have to take a look at your x-rays. And at this point, I think you're a great candidate for care, but I need to see your films. Also, your films are a blueprint for me, Patrick, so they're going to show me where you're out of alignment, how bad it is, if you have any degeneration or arthritis.
Right.
And once I see all that, I'll be able to tell you exactly a couple things. Number one, are you in the right place? I think you are right now. I won't know until I see your films. Number two, if you're in the right place, I need to know exactly what to do with you as far as your care plan, right? So I'm going to tell you how long that's going to take and how much that's going to cost. Is that fair?
Fair.
Okay. Second thing is, and probably your most important appointment, is something we call your Better Results Faster workshop. Okay. Most of the problems that people have when they come into my office are the result of things they're doing outside of my office.
Right.
Okay. And remember we talked about how you're eating and the fact that you sit all day long, and remember you had that car accident. So some of these things you have control over, right? Like you're sitting, what you're eating. Some of these things you don't. How you're sleeping. The car accident, you don't have any control over that.
Yeah.
What I want to do is I want to go over the things that you have control over that can help your care and also help you get better results. That's why we call it Better Results Faster, because nobody wants to get worse results slower. Everybody wants to get the quickest results as fast as possible. If you do the right things outside of the office to help me with what I'm trying to do in here, you're going to get great results. If you don't, then we're going to be kind of butting heads, and it's just going to take a lot longer. Okay? So first of all, your report of findings, I'm here Monday and Wednesday. So today is Wednesday. Does next Monday work for your report of findings?
Yeah, definitely.
Okay, awesome. And then your Better Results Faster, we do those every week at 7 p.m. on Thursdays. And I'd like your spouse to be there, Patrick, because your spouse is going to help to support you with the decisions I'm going to ask you to make. You know, and it's nothing big, but you need somebody to hold you accountable to actually do the things I'm going to ask you to do outside of the office.
Okay.
So I'd like your spouse to be there. So would 7 p.m. on Thursday work for you and your spouse?
Yeah.
Okay, great. So let's go up front. We'll get those 2 appointments scheduled.
Got it.
Okay?
Sounds good.
So awesome, right, guys? And so that's just my script for the end of the examination. We want to go over, get his report findings scheduled, get his better results faster, and explain to him why. You know, that's the biggest problem I see why people don't go to your classes, your better results faster, 8 weeks to wellness orientations, because you don't explain to them why they need to be there. And why they need to be there is the choices they're making outside the office are going to really affect your care inside the office and if they get great results, right? So that's why you need to explain that properly to them. And then after everything is said and done, guys, basically what happens is my CAs will develop the films, they'll develop the posture screen mobile picture, they'll put the wellness score together, and they'll put together a report of findings packet for that patient. In the interim, I'm going to fill out this form. Okay, this form is a care plan template, and what you're going to see is 3 months. So if we take a look, month 1, month 2, month 3, I'm going to write down how many adjustments month 1, generally 12 adjustments. 12 adjustments month 2, month 3, right? Whatever the care plan is. Are we going to do any 60-minute functional training sessions? Are we going to do any posture preps and posture rehab? These tend to be 1-hour sessions. These tend to be 20 to 30-minute sessions. Are we doing any massage in their care plan? Are we doing intersegmental traction or any flexion distraction? Are we doing anodyne, cold laser? Are we doing the BRF workshop? When is that scheduled? Are we doing a spinal care kit? And then whatever supplements I'm recommending in the care plan are going to go in here. So we write down the number of visits, month 1, month 2, month 3. It all gets totaled, and you'll see here, guys, this would be the total program cost with no discount. We also have the right number here, which is going to be our monthly payment. So that's going to be the total amount of the care, right? And then this is going to be the discount. So up here, we write down the total amount of the payment, the total payment, and then the discount that they would get. So we would give them a 5% discount if it's a 3-pay. That would go here, so it would be the total amount minus the 5%, and then we also have the monthly payment here. So we write the 3-pay amount here, and then here we have the prepay amount. So we have, whether you give 10 or we give 10% off. So we take their care plan, take 10% off. They're going to save $435, and that's going to make a total prepayment amount of whatever that is less 10%. Okay? That makes sense, Roger?
It makes sense.
Hopefully I didn't screw that up. Now, one of my favorite care plans for 8 weeks to wellness patients, guys, is a 3-month care plan. You'll see 8WW here. So we're doing a 1 month of care starting 8 weeks to wellness in month 2. So I'll generally write that in here. I'll write out 1 month of care, and then I'll put start 8 weeks to wellness, or I'll circle 8 weeks to wellness, and I'll write in here 8 weeks to wellness, month 2 and month 3. This form at the end of my shift goes into our billing manager's desk. She has a file on her desk. This goes in there. She will then calculate the finances based on the patient's insurance. She will then put, my CAs will put the report of findings pack together. So the pack is just a bifold, right? On the left-hand side, we have the wellness score. We have printed copies, digital copies of their x-rays. We have their posture screen mobile pictures, AP and lateral, okay? On the right side, we have their care plan, that form. We have their financials, the 3 numbers in there. We also have a merit chart where I've circled where their subluxations are because I go over that with their report of findings. And we have a brochure in our office with some of the services. Generally, Roger will have like an event flyer or something like that. Anything that I'm missing in the folder? I think I got everything. Wellness score, x-rays, posture screen mobile pictures. I think that's it.
We usually have a checklist on the front of the folder to make sure any.
Yeah, so the girls have a checklist to go. I'm just wondering, I don't have the checklist, so I want to make sure that I got everything. I'm almost positive I did. The big 3 things, guys, are the wellness score, the x-rays, and then also the posture screen mobile pictures, because that's how when you guys will see when I do the report of findings, that's how I cover it. I go wellness score, then I actually go postural pictures, then I go x-rays, then I go treatment plan, and then I go finances. All right? Anything that you guys want to add? No? Our dear friend Patrick's leaving us. He just got his MBA, and I told him it's a really great day for him and a really sad day for us. How long have you worked for us?
3 years.
3 years.
3 years.
And I was talking to some of the patients this morning, and they're real sad by the fact that you're going. But I've just seen the human being you've grown into, Patrick, and it's been a pleasure to have you here. And we're gonna miss you a lot.
Yeah, me too. I'm gonna miss it. I mean, I've seen lives change like every day in front of my own eyes, so it's unbelievable.
Yeah, and these are the type of team members you want, guys, because they don't come to work for the money. They come to work because they change lives, right? So that's the kind of people that you want on your team. So, guys, I hope you have a great one. We'll be playing this during the coaching call, and then next module we're gonna cover the report of findings. I probably forgot something, and if I did, I'll make sure that I look at this and I get back to you. So we kind of did this off the cuff, but I hope you guys have a great week and a great weekend.